Hello, my name is Ravi Vij. I am from My Cancer Haven, and in our Conversations with Cancer Experts series, today we have the honor of having Dr. Sameem Abedin, who is Associate Professor at the Medical College of Wisconsin in Hematology, Medical Oncology. And we're going to talk about some emerging areas in this field of what was formerly focused on myelodysplastic syndromes, but new entities have emerged over the last decade, CHIP, ICUS, CCUS, and this new entity of Vexas syndrome. So to educate us about this, welcome here, Sameem. Glad to have you here today.
Yeah, good morning, Ravi. Thanks for the invitation, and I look forward to discussing these related entities with you.
So I guess to put it in context, obviously we've known myelodysplastic syndromes for a long time. And so that is when you have, overt disease, and pathologists can look at changes under a microscope. But some of these entities that we're going to first talk about precede that. So help us put in context. So what is this entity CHIP?
Sure. So CHIP, or clonal hematopoiesis of indeterminate potential, first of all, represents, as opposed to ICUS or some of the other syndromes, potentially a state you could find where there are still preserved hematopoiesis, in other words, normal counts. And so where, we encounter CHIP patients in clinic more recently, there's a variety of indications now to be performing next generation sequencing, potentially from the blood. So in the setting of a variety of solid tumors, liquid biopsy has become a standard of care. There are some patients that are getting so-called executive screenings for which genetic testing and imaging is being performed. In the context of these studies, what is being identified are entities where a certain population of blood cells have shared genetic features to them. So in other words, next generation sequencing is sent off the blood, and these tests are positive for a population of blood cells that have a certain mutation that links these cells together. So these are the same sort of cells genetically in an expanded fashion. So these NGS tests, they usually have a sensitivity of about 2 to 3%, when you send it off the blood. So by definition, these populations, at a minimum are, 2 to 3% of the blood cells that are being assessed. Certain abnormalities such as DNMT3A, TET2, ASXL1, these are certain mutations that could be seen then that could lead somebody to think that there is this CHIP going on. So in terms of when we find this, so this is sort of a